is Karley Oxley, and this is my persuasive speech for Communications O2I. Do you ever wonder how many germs are spread throughout a normal person's day? According to the Center for Disease Control, hospital patients get nearly 2 million infections per year. That is about 1 infection for every 20 patients. I am currently majoring in the nursing field, and it is important for healthcare providers to use proper hand washing techniques. Participating in proper hand washing can not only decrease the spread of infections and diseases, but also promote one's own health. Let's look at how proper hand washing can prevent the spread of infections and diseases, the guidelines to how and when a person should wash their hands, and the importance of proper hand hygiene in homes, schools, and hospitals. First, let's look at how proper hand washing can prevent infections and diseases. Hand washing is one of the most effective ways to prevent the spread of infections or diseases. I will go over from an online article from Infection Control Today about how proper hand washing techniques prevent infections. It is important to wash hands to not only infect others, but also one's own self. The aim of hand washing is to remove microorganisms from the hands, preventing their potential transfer. Hand washing reduces the number of transient organisms on the skin surface. Although hands cannot be sterilized, most transient organisms can be removed by 30 seconds of proper scrubbing with soap and water. Proper scrubbing would include vigorous motion with the hands rubbing together and fingers working in between the finger web space and inclusive of the dorsal and ventral sides of the hands. According to Infection Control Today, surveys show that one in 5 medical professionals carry potential pathogenic antibiotic-resistant pathogens on his or her hands. Hand washing by medical professionals occurs at only 30% of the ideal rate. Failure to wash one's hands before and after each patient contact is probably the most important contributor to the spread of infections. These microbes pose a threat to patients with reduced defenses, so scrubbing with an antiseptic prior to contact with these patients is usually recommended. Now that we know how proper hand washing techniques prevent infections, I will go over the guidelines of when a person should wash their hands from the Center for Disease Control. When should we wash your hands? You should always wash your hands before, during, and after preparing food. Also, washing hands is important before eating. Hand washing is also important when you are caring for someone who is sick. Always wash your hands after doing so. Always wash your hands when before and after taking care of a wound or cut. After taking out the garbage, touching an animal, or using the toilet, always remember to wash hands thoroughly. When should healthcare providers wash their hands? When hands are visibly dirty or visibly soiled with blood, wash hands with non-antimicrobial soap and water. If hands are not visibly soiled, use alcohol-based hand rubs. Always decontaminate hands after having direct contact with a patient. Many of you know the proper hand washing technique, but I will also go over that. Wet hands with clean running water, which could be warm or cold, and apply soap. Rub hands together and make a lather. Scrub them well and make sure to scrub the back of your hands, between your fingers, and under your nails. Continue rubbing hands for at least 20 seconds. After, rinse hands under clean running water and dry hands with a clean towel or air dry. Now that we know how hand washing prevents infections and the guidelines, I will now go over the importance of hand washing in different settings. Proper hand washing is important in homes, schools, and hospital settings. I encourage the public to carry an alcohol-based hand sanitizer with them, as now there are harmful pathogens that are resistant to antibiotics. According to an article from the American Journal of Infection Control, infectious diseases circulating in the home and community remain a significant concern. 2 factors are responsible for this trend, which are the constantly changing nature and range of pathogens to which we are exposed to, and the demographic changes in the community, which affect our resistance to infection. Hand hygiene is a key component of good hygiene practice in the home and community and can bring significant benefits in terms of reducing the incidence of infection, most gastrointestinal infections, respiratory tract, and skin infections. To what length will hospitals go to make sure their employees are washing their hands? According to an article from New Public Health, the answer for North Shore University Hospital is thousands of miles to India, where employees check their monitors, trained on the hospital floors, to find the workers who skip the sinks on their way to the hospital's intensive care unit. According to an article from Health Promotion Board, each year in developing countries, about 1.5 million children die from diarrheal disease due to poor hygiene and lack of access to proper sanitation. The 2005 World Health Report mentions that households can prevent illness by washing their hands after defecation, before preparing meals, and before feeding children. You now know how proper hand hygiene reduces the spread of infections and the importance of hand hygiene in homes, schools, and hospitals. I strongly encourage everyone to participate in proper hand washing to not only prevent the spread of infections and diseases, but also to promote one's own health to live a healthier lifestyle. Now that you know how to properly wash your hands and when to do so by the Central Disease Control, hopefully you now engage in this important concept. The simple act of washing hands is someone's own responsibility and can save many lives. I hope you now understand the significance of proper hand hygiene. Thank you.